Hello, and welcome to the ILO Future of Work podcast. I'm Isabelle Piquer. Today, we are talking about something that affects millions of workers around the world, but that is often invisible: psychosocial risks at work. A new ILO report shows that the way work is designed, organized, and managed can have a major impact on workers' health and well-being. Risks include things like long working hours, workplace bullying, or job insecurity. To help us understand these issues and what can be done about them, we're joined today by Manal Azzi, Team Lead on Occupational Safety and Health Policy and Systems at the International Labour Organization. Hello, Manal, and thank you for being with us.
Hi, Isabel. Thanks. It's a pleasure.
So let's start with the basic. What exactly is psychosocial working environment?
Actually, that's where the issue lies. It's really in understanding and defining what we mean by the psychosocial working environment. Historically, the word psychosocial, that is psychological and social, has been a bit misleading because we assume that it's only in relation to mental health concerns or psychological issues or issues related to social interactions. But of course, it is much wider. And today in the new ILO report, the way we suggest to define and to understand and break down this concept, we refer to the aspects of work that are related to how the job is designed, how the job and the persons are managed, and also about the broader policies and practices and procedures that govern the workplace as a whole, and the interactions in between all of these levels, but also interactions between people that are related in this context to these levels. But the issue is also how these aspects and dimensions impact the health of workers. So if they impact them negatively or positively, if people are doing better or thriving because these are managed properly, or if it's affecting negatively their physical and mental health, then the whole understanding of psychosocial working environment is all these dimensions and the potential impact they have on the health of workers.
So more specifically, can you give us examples of what are the psychosocial risks that workers can experience in their everyday life?
Yes, absolutely. So, looking at the research over the past decades, we've been listing different factors, different risk factors, different hazards in relation to what we mean by psychosocial working environment and different examples. What the new ILO research is proposing is to organize all these ideas into the three levels. That way, we can target action across these levels. The first understanding is the job itself. So what are the characteristics of the job inherent to the job? Does the job itself have cognitive demands? Is it a high demanding job? Are you a surgeon? Where do you work? Or does it have emotional demands? So do you work as emergency service provider? Do you have a lot of emotional demand? And that has its implications, obviously. Are your skills matched to your job? So if we're looking at the job design, are you in the right place? Are you doing what you are trained to do, or are you doing something else? And what kind of variety does your job? Is it a repetitive job? Is it a job that allows it to be meaningful for you as a person? So when we look at the job itself, we look at the task itself, and that would be the example at that first level. And then if you're looking somewhat at a traditional workplace, there are managers. There are managers that immediately supervise the work you do. It could be in office work. It could also be along a production line. You have a supervisor. And here there's a level of control that your manager has. They decide what tasks you actually do. They give you the time that you need to deliver them by. They provide you or not with the resources to do that. Are there people that are helping you? Do you have enough funding to do what you need to do? Do you have time to do it? So it's really the workload and the pace. There's also the issue of clarity. Is your job clear? So sometimes you're hired to do something, but you're doing something else. And do you get support? So if there is a problem, is there continuous communication? Are you getting continuous feedback? Do you have opportunity to grow in the role that you're playing? So all of these that are related to the immediate management and control of your actual job is that second level. And then we go to the third level, which I think is really important because it sets the structural issues at work that sometimes are the source of the problem. Because we tend to jump to the individual, oh, you did it, you reacted too violently to this issue, you should be more resilient to some of these issues. But really, some of them are quite structural. So if we look at the policy at the workplace level, we're looking at things related to working time. Do you have flexible working arrangements because you have other responsibilities? What kind of job contract do you have? What kind of employment arrangement do you have? That could be the source of your anxiety and frustration. What kind of career growth opportunities do you have, or any kind of improvement? It doesn't have to be white-collar jobs. We could be talking about any kind of jobs. Like, do you see yourself moving somewhere? Is there a chance for you to be promoted? There are also performance appraisal systems. Do you have any? Do you have that feedback mechanism that allows you to be recognized, validated, or also to retain you in your job? Other equality considerations, gender and discrimination issues, that sometimes some of the jobs are given that are less favorable to a certain gender, a certain age category, that then undermines them when they do apply to different positions. There are so many issues, including harassment, for example, mechanisms, like once you have a complaint against a situation, what happens in your organization? Are you protected? Is there confidentiality? Is action taken? Because if action is not taken, or if there's retaliation, you're never going to speak up again. So those policies at the organizational level are really what protect you and what create an organizational environment with a culture that's a just culture, a culture of justice and a climate of safety in your workplace, or it actually exacerbates the problems that you face. So those are the examples, I would say, if we need to divide them over the three levels, and this is how we need to target our responses to improve situations in workplaces.
So by better defining this risk, we can better understand them. But also there is something that the report mentions, and is a striking figure, which is 840,000 deaths per year linked to psychosocial risk. It's one of the highlights of the report. What does it mean exactly?
Yes, I mean, the updated research we've done, we've looked into, this is the number we found, and it's actually linked to deaths due to cardiovascular diseases from ischemic heart disease and strokes, but it's also linked to mental disorder, including depression and suicide. And the way we do that is we look at these two outcomes linked to 5 psychosocial risk factors. And the psychosocial risk factors we looked at are job strain. So if you have job strain in your workplace, it means that you have high demand, low control. We looked at effort reward imbalance. So you make an effort, but you're not finding gratification of some sort. It doesn't need to be necessarily a monetary reward. Sometimes a thank you could be a reward. So there are so many levels of that effort reward imbalance or balance. And then we looked at long working hours, which is associated with some of these, the onset of these negative health outcomes. Also bullying at the workplace, and the increase in workload. So these 5 job psychosocial risk factors are found to be linked to these cardiovascular diseases and leading to death. But we looked at the evidence on 2 data sets, of course. So we looked at the number of deaths globally, but also the level of exposure. So what is the occurrence? Do we know how many people are exposed to any of these factors? And do we know that there is a link between being exposed to such a factor and having that health outcome? And then you look at the overall morbidity, mortality, and you try to estimate which of those are attributable to the workplace and which of those could have been prevented, cases that could have been prevented had we had the right systems in place.
But this is the most extreme. I mean, we're talking about death, but what are the other health outcomes? What can also happen to workers?
Yes, and those, of course, affect millions of workers. And we know that more than 44 million workers are losing healthy working years because of the experiences they have with psychosocial factors at work. I guess the mental health aspect is an established one. We have depression, anxiety. This is documented worldwide. We have
and people are more open to talk about it now. It wasn't the case even a couple of years ago.
It's becoming more of a norm, unfortunately, with the way the economic markets are structured, the way the competitiveness has increased globally, the way all companies and all businesses need to perform with less time and with more connectivity. So yes, the pressures are much more, and people are, it's absolutely necessary now that we talk about it because it's affecting finances as well. So this increase in depression, increase in anxiety, and sometimes suicide, especially if you look at high-risk sectors like construction, agriculture, emergency services, we're seeing a high level of suicide, but also disturbances in sleep. People aren't sleeping well. This has its own health impact. We looked also at metabolic disorders that people have, digestive problems because of their workplaces.
It also affects the families. And how does it affect also the businesses and society in general?
Absolutely. I mean, at this high level of sicknesses and absenteeism, also musculoskeletal disorders, the deficiencies in immunity, reproductive health, and cancer. All of this is actually affecting high rates of sicknesses at work, absenteeism, presentism. People are less engaged. They're present but not actually working. High turnover, which isn't great for anyone, and eventually affecting performance and productivity. And sometimes if we're talking about the service sector, it actually affects the quality of service you receive as a client. It affects the trust. If your healthcare services or education services, teachers, nurses, they're being stressed at work and they have all these limitations, the service that you're getting as a client or a customer is also affected. So of course it's affecting societies and the economy as a whole.
And one of the major changes in the world of work now is artificial intelligence. How do we measure its impact on psychosocial
It's creating changes worldwide, and creating changes in the sense that we don't have boundaries anymore between where we work and where we conduct our personal lives. And by having that, we have work intensity. So there's increased work, increased intensity due to this connectivity. We're also seeing more algorithmic management of work, so more surveillance of workers, which creates another level of stress, less autonomy, and that is increasing the problems we have. Of course, there are positives with the introduction of digitalization and more flexible working arrangements, which allows for more inclusion, sometimes more support. But that's only if we're able to account for issues like isolation, increased overload, digital overload, and other problems that we face by these changing issues.
And again, if we define exactly what's happening and what's going on, if we put a name on all these things happening. So now we've seen what's happening, what can be done? Because also one of the highlights of the report is that these things happening are not inevitable.
Absolutely. And so we start off always with what regulations can be helpful. And a lot of that is about defining what we're talking about. And we looked at a number of legislation globally, and some of them only talk about mental health and mental health management. And what then the requirements are very focused on individuals. They're focused on reactive measures that can be done just to have people more resilient, to support workers, to support more pressure. How can we support more pressure? But the ones that take you all the way are the ones that are embedded in occupational safety and health systems, where you are assessing the risk, you're evaluating, and you're trying to control what's happening. And so you see a lot of good regulation that give some assessment tools that provide for preventive measures and control and a better understanding of identifying these hazards. We're also seeing lots of regulation around health surveillance. So we want to be monitoring workers, what they're exposed to over time, because we know that the occurrence of a lot of these issues, it's not like you can walk around and find the risks or the hazards. It's something that happens over time, and sometimes the frequency is important and has that cumulative effect. So proper health surveillance, needs to be regulated. In addition to compliance enforcement, what are your complaint mechanisms? Some have very specific legislation on harassment and banning, and procedures around violence, around harassment are also important. So there are many levels that the regulation can cover this, but also it can require data collection, data for us to understand the trends better, understand who they're affecting more, because a lot of it is also, affecting different genders, different age, and there's that interlinkage, of course, with discrimination that are either structural discrimination in our workplaces or, case by case discrimination.
So this is what governments can do, improve the data, improve the legislation. Is there something else they need to do to protect the workers?
I mean, as governments, of course, they need to work with employers and social partners, employers and workers, to create voluntary standards, more precise guidance. But a lot of that comes back to the implementation at the workplace. So I find that at the workplace, there's a lot got to be set up and understood, and identification of the hazard, and then assessment of it. But also, you don't just identify and assess it and have one control measure. You need to continuously improve and look back at what you've changed. And here the report provides a number of examples across the three levels we talked about in terms of what can we do better in terms of matching people to their task, to their job, to their design.
So at the workplace level?
At the workplace level, yeah. I mean, otherwise you hire someone, there's a certain job description that doesn't match what they actually do, and that creates the frustration. And, some people have the skills to deliver a certain task. They can do it quicker, better, more efficiently. And then giving that job to someone who hasn't been trained for that just creates that frustration in the environment.
Everybody understands that because everybody has lived one of those situations.
Absolutely. And it's more and more because of the speed at which we deliver work today, because of the demand that we have, the little control, and because of the connectivity we talked about, because work follows you everywhere and jobs are, they're not as abundant. Of course, it varies between sectors, between occupations and specializations, but that level of pressure is increasing globally. And I think that's why it's so important to talk about it now and to understand the human as someone that is not, you're at your work, you're at your home as two separate people. It's all interlinked, and what's happening around you in the world, that needs to make sense and has implications for where you work as well.
And also, what can workers do? Because as you very well said before, it's not that easy to first identify that you are in that risk category or that you're suffering from one of those of risk, and then to report it. So what can workers do?
Well, first, I think workers are essential. So we cannot understand what's happening at the workplace level if we don't get insight from the worker. They're the best to understand their working condition, their needs, and what is bothering them. So having a system whereby workers are consulted and they meaningfully participate from the beginning is what is essential. Of course, there are different systems. You have collective bargaining agreements. When the regulation doesn't catch up, collective bargaining agreements on issues related to stress, to burnout, to digital monitoring are all really helpful. But I think it's core to have that level of communication and to have that space where workers can, with safety and without retaliation, be able to express their needs and what could make better. It can only be a win-win situation for enterprises, because if the workers are engaged and they're delivering, we produce better and everyone's happy.
Absolutely. But do we see this happening? Do we see a progress in recognizing those risks and addressing those risks in the past few years?
In some regions, we do. I mean, in Europe, this is becoming the hot topic, and it has been for decades now. I think there was essentially an issue always with trying to define the limitations of the responsibility. So the employer would say, that's not my responsibility. This person had already a mental disorder. This is not due to work. How is this linked to work? How is that health outcome linked to the management practices that I have in my workplace? But it's just established itself now because of the toll it's taken on people's lives, on their health, and on societies. So we're having to face it. We're having to up our regulations and legislation around this, and we're having to give the tools and the guidance necessary to employers, to worker unions, to sectoral unions, so that they can help inform workers of their rights around this and implement them eventually and create a safer and healthier society.
But this is definitely a work in progress.
Absolutely.
Well, thank you very much, Manal. Thank you for being with us, explaining this very interesting report. So this brings us to the end of our podcast. Today, we spoke with Manal Azzi, who's a team lead on occupational safety and health policy and systems at the International Labour Organization, about psychosocial risk at work. You can find the new ILO report on the ILO website. Thank you for listening. You can follow us on social media on YouTube, Facebook, and LinkedIn at International Labour Organization, and on Instagram, X, Blue Sky, and Threads at ILO.org. For now, it's goodbye, and see you very soon for another episode of the ILO Future of Work podcast.